now urgently warning pregnant women to get tested and, if necessary, treated for syphilis.
New data shows that the number of babies born with the sexually transmitted disease is increasing at an alarming rate. So here to answer our questions is Dr. Todd Ellerin, who's Vice Chair of Medicine at South Shore Health. So, Dr. T, why is this affecting infants?
This is so disturbing, Eddie. Just like you said, rates of congenital syphilis increasing at an alarming rate, the most in many decades. And the problem is, picture this. Pretend you're one of the 3,700 mothers who delivered a baby with congenital syphilis. There's about a 10% risk. Nearly 300 babies were either dead at birth or died shortly after. The ones who survived are often blind, deaf, severe intellectual disability. Now, think about the fact that a single dose of penicillin given at least 30 days before birth could prevent all of that. That's what we're looking at.
Those numbers and that fact alarming, Dr. T.
So let's drill down on those national numbers from the CDC. There were 334 cases in 2012. Last year, 3,761 cases. That's an enormous increase. When you break down those cases from last year alone, nearly 300 of those babies died or were stillborn. What do you think is happening here? What's with the jump?
Right, Maria, it's unbelievable. This is an absolute breakdown of our healthcare system, of our maternal-child interaction. And the issue is there are many factors at play here. This congenital syphilis needs to be a never event. But one of the issues is that when you look, it's so easily tested for and so easily treated. But you have to test the patients. And in 2022, 40% of the children, the babies who were born with congenital syphilis, 40% of the moms never received any prenatal care. So there was no testing. About a third of the moms that were linked to care, at least one visit, never had testing. So we have to figure out other ways. The other point is that this isn't equally divided among the country. As we've heard about before, this brings out health inequities. The majority of cases were in Black women, Hispanic women, and American Indians and Alaska Natives. A lot of these cases were in the West and in the South, so we have to be more strategic about our approach.
Dr. T, thanks for the information and conversation. Thank you very much.
Thanks, Doctor. Be well.
Have a great day.